What if the biggest bottleneck in AI-driven drug discovery isn't the model architecture, but the way we tell it where to look? For years, structure-based drug design has conditioned molecule generation on empty, static protein pockets. But proteins don't sit still. Solvent moves. Side chains shift. And by stripping away the very components that define the binding environment, we're forcing AI to design drugs for a ghost. Today, we're breaking down a new approach that flips the script. Instead of empty pockets, we condition generation directly on electron density derived from the actual filler, the ligand, the water, the dynamic reality of the binding site. This is EDMolGPT. Let's get into why this matters. In structure-based drug design, most pipelines start with a hollow complex, remove the ligand and solvent, and treat the remaining cavity as a fixed scaffold. That rigid pocket assumption is convenient for computation, but it's biologically misleading. It suppresses conformational flexibility, ignores solvent-mediated interactions, and fails to capture the ensemble-averaged spatial distributions that actually govern binding. Some methods try to fix this with pocket ensembles, but those are notoriously difficult to integrate into generative frameworks that require a unified, fixed conditioning signal. What we really need is a continuous, physics-grounded representation that naturally encodes flexibility and interaction patterns without relying on handcrafted abstractions. That's where experimental and calculated electron density comes in. Electron density maps, whether from X-ray crystallography or cryo-EM, aren't just static images. They're continuous fields that capture measurement noise, conformational dynamics, and all filler interactions in one go. The key insight here is to skip the empty pocket entirely and derive density directly from the filler. It's well-defined, experimentally validated, and spatially localized. And it gives us two distinct data streams. First, calculated electron density, or CalED, which we generate analytically from atomic coordinates using fast Fourier transforms for large-scale pretraining. Second, experimental electron density, or ExpED, pulled directly from cryo-EM or X-ray reconstructions for fine-tuning. ExpED captures the real-world messiness of binding sites, while CalED gives us the scale. Together, they let us unify massive pretraining with experimental grounding, all while preserving the physical signal that rigid coordinates miss. So how do we actually turn density into molecules? We sample low-resolution ED maps into point clouds. Each point gets annotated with pharmacophore features, hydrogen bond donor, acceptor, both, or other, based on its nearest neighbor in the filler. Because autoregressive models are highly sensitive to input order, we sort these points by spatial coordinates to ensure consistent processing. Then comes the molecule representation. We don't just spit out standard SMILES and absolute coordinates. That approach frequently produces physically inconsistent or unrealistic conformations. Instead, we use an improved Fragment SMILES, or FFT-based, which decomposes molecules into chemically meaningful substructures while preserving ring closures and local topology. We pair that with discretized 3D coordinates, scaled and shifted to fit a bounded integer grid. And crucially, we condition each new atom on relative geometric features, bond length, bond angle, and dihedral angle. Here, S where the autoregressive generation gets clever. Instead of sampling coordinates from a flat spatial distribution, we use the predicted relative geometry to constrain the sampling space. Given the last 3 generated atoms, the model recovers continuous bond lengths and angles, then restricts the next atom's position to a spherical patch defined by those parameters. This isn't just a computational shortcut to reduce search space. It's a hard geometric constraint that enforces local structural consistency step by step, which is exactly what you need when building 3D molecules token by token. During inference, we apply temperature sampling to balance diversity and structural fidelity. Lower temperatures lock in deterministic, stable poses, while higher temperatures encourage scaffold exploration, with the geometric constraints preventing the model from drifting into physically impossible conformations. The training pipeline mirrors this duality. We pretrain on roughly 2 million molecules using CalED, learning the mapping from density point clouds to molecular sequences. Then we fine-tune on experimental ExpED data from PDBbind, adapting the model to real-world density characteristics, noise, and flexibility. At inference time, we feed in the filler ED, which now includes solvent molecules within a 4.5 angstrom radius. The model generates the ligand token by token, sampling FFT-based and relative geometry with temperature-controlled stochasticity, while the constrained coordinate recovery ensures the final 3D structure remains physically plausible. We tested this across 101 targets from the DUDY benchmark, and the numbers are compelling. EDMolGPT achieves a 41% bioactive molecule recovery rate, meaning it successfully reproduces compounds structurally similar to known actives for nearly half the targets. In binding affinity, measured by GlideSB min-in-place docking, it consistently outperforms baselines like Pocket2Mol, TargetDiff, and Lingo3D-Mol. More importantly, it generates molecules with competitive strain energy without any post-processing refinement, proving that the geometric constraints are baked into the generation process itself. When we switch to ExpED, the model generates ligands that would be outright rejected by rigid pocket docking due to apparent steric clashes, but biochemical assays confirm they're actually active. That's the density doing its job, encoding pocket plasticity that rigid coordinates simply miss. This isn't just another incremental step in generative drug design. It's a fundamental shift in how we condition AI on structural biology. By replacing rigid pocket abstractions with low-resolution electron density, we're giving models a physically grounded, flexibility-aware signal that aligns much closer to biological reality. EDMolGPT demonstrates that decoder-only autoregressive architectures, when paired with the right geometric representation and density conditioning, can generate novel, bioactive scaffolds with accurate 3D conformations. As experimental density maps become more accessible, and as we push toward truly dynamic, ensemble-aware drug discovery, this kind of physics-informed conditioning is going to be essential. I'll drop the paper link and project page in the description, along with the code and dataset details. Thanks for watching, and I'll see you in the next one.